Welcome, and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. On the program today, we're going to be helping people along with perhaps one of their New Year's resolutions, and that is kicking a bad habit, perhaps an addiction, maybe getting yourself fresh and ready and painted to go and achieve all new goals. But being able to find a way that you can do that on your own sometimes is difficult, if not most impossible, especially if that addiction has been hanging around for a while. Well, on the Beyond 50 radio program today, we're joined by a company that's been around for more than 79 years, which has pioneered a new form of mental health aid, peer-based, self-will training. They are positioning themselves to help 1 million people begin or continue their mental health recovery. Just imagine the impact that could have on people everywhere, wherever people are stigmatized. I'd like to welcome to the Beyond 50 radio program today our guest from Recovery International, joining us here on the Beyond 50 radio program to tell us more about this and how perhaps we can include this into our repertoire. Welcome to the Beyond 50 radio program.
Thanks, Daniel. My name is Rob Winnicke, and I'm here to talk to you today about Recovery International.
Now, as I was saying earlier here in the program, almost 80 years you've been around. Tell us about this.
Yes, Recovery International provides support group meetings and self-help techniques that offer symptom relief to adults suffering from most any mental health issue. By gaining the skills of our life-changing method, participants can lead more peaceful and productive lives. And over the last 78 years, RI has equipped over 1 million people with tools to control behavior and change attitudes.
Now, tell us how RI, Recovery International, help people with nervous conditions.
Okay, Recovery International is the world's premier self-help, self-will training program. It's a worldwide assembly of in-person weekly meetings, and then there's web and phone meetings as well. We also give mental health seminars in the community to help people change their lives for the better. Though nonprofit and mostly driven by non-professional volunteers like me, Recovery International certified leaders give people the tools they need to lead more peaceful and productive lives. So our mission is to provide self-will training for mental health and wellness anywhere in the world to anyone, anywhere, anytime. Mm-hmm. These self-help training meetings, there's 2 of them meeting right here in Portland each week. They're proven to be effective for people who are suffering symptoms of anxiety, anger, depression, and hopelessness. The stigma of suffering from a mental ailment, which you mentioned in the beginning of your introduction, that can be eliminated by joining a group that can offer compassion and mutual aid. RI training has helped hundreds of thousands of people who struggle with a nervous condition, or what we call lowered feelings. We're hypersensitive to labels, and that because labels stigmatize, so we refer to ourselves simply as nervous persons. Dr. Lowe's our founding psychiatrist, Dr. Lowe, our founding psychiatrist, is also referred to us as sensitive souls. And in his autobiography, My Dear Ones, he refers to sensitive people who suffer as dear ones.
Mm-hmm. You know, that seems to have a very respectful approach when you consider the kind of modalities that are out there for people who are trying to, as I was mentioning earlier, perhaps end the addiction. And especially for those people who happen to go into state-mandated programs, one of the first things out of their mouths, and I think it's sometimes the dumbest thing you can say, but, you know, it's their choice, is, you know, hey, look, we're not judging you, this and that and the other. Well, that's exactly how this person feels, so why bring up something they feel already?
Exactly. And mental health stigma these days receives a lot of negative exposure in the press. More people are looking around for economical, useful mental health solutions. RI is the most useful of all because you can heal and grow at your own pace and within your own budget. Free will offering whenever you can, it's very economical. A study by the University of Illinois in Chicago showed that everyone who participated actively in recovery got better. The more they participated, the more they improved. 80% had been diagnosed with a mental disorder, half had been hospitalized, and their diagnoses were across the board: depression, bipolar, anxiety disorder, and schizophrenia. All the people who attended meetings and practiced got better.
Now, if you could, for me, how made this, and I know I seem like, because you're saying it's mental health issues also, and I'm sometimes thinking, or mostly thinking of addiction. We think of somebody who has an alcohol habit or a drug habit, whatever the case is, that, how would this, let's say, differ from a 10-step program?
This is a training program.
Okay.
And it involves using peer-led examples of how the method works. So the meetings are structured. It's not like a 12-step program where you get 5 minutes to talk and you almost you're airing your problems. These examples, as I'll tell you about in a little while, they're given in a structured way to improve people's confidence in their own ability to achieve mental health recovery. People want to ask others for help and support. They want increased feelings of hope and improved self-esteem, increased coping skills and social connectedness skills. Mainly, they want fewer mental health stigma thoughts and less use of mental health social services. So our findings suggest that 1 year after people come to their first RI meeting, they see significant decreases in the number and severity of their anxious and depressive symptoms. And by practicing the method during the week between meetings, their mental health symptoms do not dominate or control their lives as they once had. They have increased confidence in their ability to achieve their own mental health recovery.
Now, I like the way you put that, and I want to lend clarity to the listeners here. I brought the idea of the 12-step program in, and I've actually brought in and talked with someone who says, the 12-step program, the way that it's actually being used today, is not the way it was originally structured and set up. And what I mean by that is it tends to keep people in a situation that gets them more dependent on others, because they come to the belief through their regurgitation of their story that they're weak and they were unable to do things for themselves. So it gives a person a feeling like, I can't do this without everybody else. But with RI, it sounds to me it's very much the opposite. The idea is to get you to a point that you feel confident that you can step out there into that world and you can do these things for yourself, and that this is more of a situation you may be in that seems temporary and it can be worked with.
Exactly. And the practice that people do during the week shows, because when they come to the meeting, they're prepared, they're ready and eager to give an example so they can more or less test the waters with other people who have more experience than them. This whole method depends on spotting. That's a term you may not have heard before. That's identifying a disturbing feeling, sensation, thought, or impulse, the four things that give us symptoms. These might have been previously unseen. So the technique of learning to spot what's going on with your mental health and your body, and then applying the right recovery tools, it means you have a new skill. You have an objective mind that is able to look into yourself, watch your statements and your thoughts and your wishes, and don't interpret them in such a manner as they do you harm. I personally use the acronym SPOT, SPOT, to remind myself to use a simple phrase to overcome tension. For instance, in the case of this talk here, if I should become short of breath or nervous about mispronouncing a word, the RI process helps me identify my symptoms or my temperamental reaction and to remember a tool, a spotting tool. For me, that tool might be have the courage to make mistakes or try to be realistic, not exceptional. These short sentences that I use help me to drop my temper or manage my symptoms And in times of distress, we learn we can use that objective authority voice. I could say, Rob, any decision steadies you. What I fear most are my symptoms. And that brings me back to that objective mind. So it's almost as if the peer leaders are with you because you've got a new way to spotlight or to see or notice and focus in on what is upsetting you.
It's just so fascinating to hear you talk about this in this particular way because you can see how uniquely different, and it's just amazing this has been around for 80 years, yet typically that modality that's out there seems to follow that more traditional way. For instance, if you could, you hear about psychiatry has cognitive behavioral therapy, but what distinguishes cognitive behavioral training from psychiatry's cognitive behavioral therapy?
Well, let's see. The therapy, first of all, the economics. Therapy is expensive and it's not available to everybody. The RI method is available for free will offering, and that's not mandatory. We're a nonprofit organization that relies on sponsors, partners, and income from our member meetings. The training involves effort from participants. That's the price for success. We say the method is simple but not easy. Most newcomers will notice results and get relief from the very first meeting, but 3 months is the recommended time to evaluate the method's potential for changing people's lives. Sustainable growth and healing comes after they develop what Dr. Lowe calls the 3 essential wills: the will to practice, the will to persevere, and the will to patience. Recovery practice engenders realism, and it's a plain common sense approach, but it's a disciplined, objective way of viewing your life, and that takes time. Newcomers can accelerate their growth by becoming annual members and taking part in telephone, online, and web-based trainings. Schedules are available on our website. But the key to success is practicing moving your muscles to inspire and use positive thoughts and language.
Wow, that sounds so interesting. So tell us what happens where, let's say, for instance, would a nervous person feel safe at a group meeting?
The safety of a meeting is paramount. Meetings are safe and anonymous. We don't diagnose, comment, or advise on diagnoses or treatment plans or medications. We don't offer any advice or replace professional treatment. We don't criticize, judge, or make negative comments. We also don't discuss politics, sex, religion, or legal issues during our meetings. These meetings can be held in a church because meeting rooms are available and affordable, but RI has no connection with any religion or organization or 12-step support group.
Mm-hmm. Fascinating. Now tell us about the format of the meeting and what happens there.
Well, I want to talk, too, about the reassurance and fellowship that newcomers get by meeting friendly people with similar problems that have found a way to live a happier life. These people understand your symptoms and their cause, and it's a safe place to express your feelings without being judged. Hope from others who have bettered their lives, support for and acceptance that may be lacking at home, work, or school, that's an important factor. Self-help through learning and practicing a simple set of living skills which encourage and improve personal growth, and then the group supports you as you apply these sayings to your everyday frustrations. Try, fail. Try, succeed. That's a simple phrase that is signaling to your brain you may not be successful the first time you try, but by trying again and being willing to fail and move on, any decision steadies you. So we practice having the courage to make mistakes in the trivialities of everyday life. Some things must be patiently borne, bravely faced, and humbly tolerated. Not all problems that people come to the meeting with are trivial, but a lot of the essential symptoms that people bring to their first meeting, like tremors or fears, panics, head pressure, loss of appetite, overeating, sweats, palpitations, difficulty in swallowing, lightheadedness, obsessions, jealousy, difficulty in making decisions, feelings of inadequacy and persecution. All these sensations and fears can be lessened or deleted by using the RI method. So you asked about the format of the meeting. Here's how a meeting is divided up. A welcome and introduction of newcomers, followed by a short reading from Dr. Lowe's literature. That's important because his language helps everyone work together with a common understanding. Then individuals voluntarily offer a 4-part example of some trivial event that occurred to them, causing them to get worked up. That's the language that we use. Other group members will then spot for them tools that were used or might have been used, and they also comment on the progress the example giver has made so that he or she is reminded to self-endorse in a variety of ways. Well, I'll talk to you about self-endorsing in a little bit. After the example period comes, then a mutual aid period follows, usually with snacks. This is an informal time for members to gather in small groups, and strategies for improvement can be suggested. Newcomers are encouraged to set goals and return for another weekly meeting. Leaders and assistant leaders remind everyone as they leave to endorse for being group-minded and for being self-led.
Fascinating. Now, I know that in a situation such as a group meeting that you might have temperament and then temper. Tell us about the difference between those and why it's, important to distinguish.
Well, I'm glad you asked because it's a factor that has affected me most personally in my life and in my marriage. Dr. Lowe explains that temperament is the quality within us that receives impressions and responds to them. People who are afflicted with nervous ailments are extremely sensitive. That's their natural temperament. And the original responses of their native temperament are aroused by actions, statements, and events that other people less impressionable would overlook and ignore. People who judge things, other people, and things like fate to an excess, those people begin to judge themselves harshly. They become intolerant, disgusted with themselves, suspecting themselves. This is what Dr. Lowe calls when the person is turning against himself. Say somebody maintains silence in their presence. Instantly, they're likely to construe the reaction as a slur or indifference or neglect, or they commit a minor blunder and sustain minor losses or failures. The average person would take these mishaps in stride without impacting his temperament. But nervous people are apt to respond with self-blame and embarrassment or a sense of inefficiency. This, Dr. Lowe says, is in itself no calamity. It just indicates that patients are unfortunately blessed with temperaments which pour forth endless streams of original responses. These responses are no different from other people's, but we are the victims of nervous trouble. We're blessed when we see our symptoms and begin to transform our suffering. Anybody at any time might feel slurred or neglected, and they may indulge in self-blame and a sense of embarrassment. But with the average person, those inner disturbances are readily forgotten or dismissed. But with some nervous people, there are no minor and no common disturbances. Every disturbance has to them the major aspect of an urgent emergency, especially with regard to family, where Dr. Lowe says we find tension 10 times higher than in other situations. And if that tension takes on the aspect of danger or emergency, then emotions are mobilized and temper is released. Minor apprehensions are fanned into major explosions and panics and tantrums. And one expert said, we treat a broken plate like it was a broken back. So these dramatic or dramatized developments they can be checked if a person is trained to regard as worries or embarrassments as what they really are, the innocent outpourings of a temperament which has been sensitized by an endless career of suffering. Innocent outpourings, a result of a long career of suffering. That would be the essential definition of the nervous person who comes to one of our meetings.
You know, I was just thinking, as President Barack Obama gave his final State of the Union speech, one of the things he really didn't talk too much about was our veterans. And I found that a little shocking considering that nearly 25,000 veterans have been discharged with other than honorable honors. Basically what's happening is they're saying we don't want to continue to provide any kind of mental health or any other kind of help whatsoever. This is a way to deny them that benefit. And this is, something that I looked into. And I thought, this is kind of strange that these people would go and they would dedicate their lives to the defense of our country, only to have our country basically abandon them and tell them, you're on your own. And from my understanding, there's a rate of 22 suicides almost daily from veterans. And I think to myself how vital something like this is, because these are people that, let's say, for the most part, go into a situation as a normal civilian, experience traumas they would never experience, hopefully, as civilians, and now they return and trying to cope with, a situation that basically has totally changed on them. You got PTSD and the like, and you think to yourself, boy, that just seems like a big hill for somebody to try to climb to actually get back to what could be considered a normal life.
And that's just the veterans. That's just one sector of the people who suffer. In the U.S., the CDC says more than 41,000 suicides and 836,000 emergency room visits for self-inflicted injuries happen every year. So we've got a lot of work to do here, and our purpose is to help people who attend our meetings regain and maintain their emotional health. And it's not going unnoticed. This past week, thanks in part to a $15 million appropriation from Congress, the National Council for Behavioral Health launched a campaign aimed at training 1 million people how to spot when someone is experiencing a mental health or substance abuse emergency and be informed about how to respond. It could be called something like CPR training for people who experience mental distress. So while the stigmatizing press has a negative effect, it also has an eye-opening effect to the population as a whole, that our society would be healthier if we helped people who have unhealthy mental practices.
I think that's such a fascinating thing that you brought up, and I've seen that in the producer's notes about the fact that you had an appropriation from Congress of $15 million to be able to train people to do this very thing. And I think to myself how powerful that could be if a few people in a community were able to do exactly what you were talking about, how they can begin to say, okay, how do we reach out as a community and help this person through this? So
right.
They become a very proactive member of our community. You can almost imagine the gratitude as that happens, that person who needs the help would feel toward a community that really cares about their well-being.
Of course. That's happened in many places in other countries where they have turned their resources towards helping people who suffer like this. And I see it happening here in our country, too. There's a new awakening to how our neighbors and people in our own families suffer, and it just can't be neglected, because if their suffering isn't transformed, they start transmitting it to people around them. So as nervous people, we want a strategy close at hand to help us calm down. That strategy might be something unemotional or nothing to do with excitement, quite the opposite, boring or mundane. We just want to be able to have a system in place to signal to ourselves that we need a shift in viewpoint, to that objective mind, to take a total view of our life. From a viewpoint of a person's whole life, startles and scares and deadlocks with difficult people all seem pretty average, even trivial. So when I go through that, I can almost hear Dr. Lowe reminding me, let's don't take our own dear selves too seriously. And that's really helped me in my marriage because my wife is a fearful person and I have angry temper. So her innocent outpourings might be letting out a screech when she loses her keys. And my angry response would be, can't you control yourself? You're upsetting me. So
Sounds
I'm
like a
adding
typical
my
marriage
angry
in
temper
America.
to her fearful temper, and now we've got a vicious cycle. But once I learned about this temperament that Dr. Lowe says we're all born with a native temperament, and we could no more change that than we could the color of our skin, I was able to accept that her outpourings were just a result of her natural temperament, and they don't affect me if I keep them as the external environment that they are. It's a little tricky. I can, as I explain it to you, it sounds tricky, but if you practice it every week, it becomes really second nature, and that objective mind can become your best friend and traveling companion.
I'm also reminded of best-selling author Dr. John Gray, Men Are From Mars, Women Are From Venus. And he says, women just want emotional acknowledgement for their problems. Men want to be able to solve those problems.
Yeah. But,
and if you
even
can come to know
Gray,
that, then you just realize, okay, honey, I see you're really going through something rough here. Just let me know if there's anything I can do to help. In the meantime, I'm here.
Right. And Dr. Gray has his rules, too. He says the woman goes down in the well, the man goes in his cave. But if the woman stays too long in the well, it's the man's job to go down there and bring her out. And we have rules like that, too. If you have a temperamental reaction that is upsetting other people, you have an obligation to take care of that, to use the tools that you're given. And Dr. Lowe says the only hopeless case is a person who has tools and refuses to use them.
Isn't that the truth? Now tell us, how long does it really take for a person to experience results with this method we're talking about here today?
There's a lot of takeaways in the first meeting. If people learn the technique of spotlighting their symptoms, being able to understand what they feel and why they feel it, that's a huge takeaway just for coming to the first meeting. Plus, we teach them to self-endorse for coming to the first meeting. Self-endorsement means giving yourself a pat on the back, a mental pat on the back, and it builds esteem, lost self-esteem, which is a natural byproduct of being a nervous person. So after the first, let's say, 3 or 4 weeks, you'll start to become familiar, and the tools will be second nature, the terminology, and we find that after 3 months, people who came into the meetings loaded with symptoms are now nerve-resistant to symptoms. They still have them, but they don't interrupt their normal way of life. After about a year, you start to develop what we call tolerance to symptoms. You hardly even notice that they're there. Some people stay on for as long as 15 or 20 years and help newcomers along because they're kind of paying it forward. Plus, as you get older, you have your own startles, your own setbacks to deal with. By staying involved with the method and staying current with your skills, you're ready for any setback to end and a comeback to begin.
Now, you don't use what you tend to see in recovery programs like the CHIP method, do you?
I'm sorry, what?
There are recovery programs that do what they call the CHIP method. Here you've earned your 1-year CHIP, your 18-month CHIP, things like that. And I always found that although it's probably good intention because you're rewarding somebody, I guess, for call it good behavior, staying on track, but that could also be kind of devastating because what happens when that day comes that they might fall off, and then all of a sudden that devastating feeling of guilt that somebody has, geez, I went this far and I really blew it, and then here comes the self-loathing and the beating up as you were talking about earlier. Well,
in these meetings, a person can track their progress from meeting to meeting because you're meeting with peers who know your problems. They know what your symptoms were when you came in. So week by week, month by month, it's easy for other members to give you a commendation for the progress that you made. So it's much more, the rewards are much more internal and personal than to just hand out a coin that only marks time.
Yes, absolutely. Now, for our listeners out there, how can they find out more about Recovery International?
Yes, well, they can go to our website, www.recoveryinternational.org, and you can purchase materials from there. You can see videos of different kinds of mental health presentations. And you can also purchase Dr. Lowe's materials there, or you can call the corporate number at 866-221-0302. If you're in the Portland area, you could just call me at 503-810-2789, or come by my Tuesday night meeting at 6:30 at St. Michael and All Angels Church in Northeast Portland. And there'll be a lot of things on the internet, too. I have my own blog site, www.selfhelptools, all one word, SELFHELPTOOLS, selfhelptools.org. And I'm hoping to come back and talk to you again.
Absolutely. After all, anybody out there who's feeling nervous, which is what we call...
Hey, we're Americans. We're restless.
Yeah, I think that's just the way it's all been set up. And Rob, I want to thank you so much for taking the time today to share this very interesting approach to helping people unravel their nerves a little bit and kind of get back to being the kind of people they would like to be.
Sounds good, and I appreciate you giving us the time.
You betcha. We want to thank you, the listeners out there, for tuning in. Now you have a direction to go in case you need that really strong support for your New Year's resolution to move and be the person you've always dreamed you wanted to be a little bit less nervous, more productive and happy and self-assured. You can also discover more by visiting us at Beyond50Radio.com. That is the number 50. We encourage you to sign up for our free weekly e-newsletter as well. You can also follow us on Twitter at Beyond50Radio as well as Facebook. I'm Daniel Davis. Thank you for tuning in. This is the Beyond 50 radio program, and remember, live your day past halfway.